So I think Vishal, you can go ahead. We just heard
Dr.
Dr. Timothy Life telling most of his talk was on clinical trials and all. But what everybody is interested, he did show a couple of cases. But what is the real world experience in nAMD with this faricimab?
Thank you, sir. Thank you, AIOS, APO, and Roche for having me here. So I'll be discussing the Indian real-world experience in nAMD. Although it was only launched early last year, we have a modest data. But whatever we have, I'm going to share with you, and I'll go directly, to the cases because Dr. Timothy has already, discussed the pathophysiology of the drug. These are all my disclosures. So, and the first thing is, why do we need real world experience and why is it important? Because as clinicians in our OPD, we do not treat our patients of nAMD or DMD on the basis of the trial criteria. We do not see the lesion size in every patient and decide not to inject or inject. And we do not follow a strict protocol and keep on injecting these patients for the next 2 years. Basically, it's a very heterogeneous population of patients as opposed to RCTs, which is the data is collected in the research settings with a more homogeneous patient population. So, Vabysmo is now approved in 107 countries and more than 7 million doses have been distributed globally with a very robust safety profile. My experience is of now more than 300 injections since January last year when it was launched in India for nAMD and DME. It has yet not been approved for RVO in India. So coming to the cases, few most severe cases, mainly PCV cases, mostly switch patients. So this 80-year-old gentleman, one-eyed gentleman, had multiple anti-VEGFs, and yeah, you can see the fundus photographs on the left side and the serial OCTs on the right side, and this had been injected with multiple anti-VEGFs elsewhere, presented with a fresh bleed with foveal fibrosis. We gave 3 loading doses of Vabysmo here, and you can see the serial OCTs on the right side, and you can see the dramatic resolution of the hemorrhage on the left side. And the last OCT is actually 24 weeks now after the 3rd injection of Vabysmo. The patient has not required a 4th injection till date. The improvement, of course, in the visual acuity was modest because of the fibrosis here. Coming to the second case, again a one-eyed gentleman, aggressive RAP lesion, and you can see the fibrosis and the fresh bleed, treated with aflibercept, multiple aflibercept with us only. And at that time she came in February, and these are the serial OCTs on the right side. You can see the resolution of the fluid and the resolution of the bleed on the left side of the fundus photographs. In the last OCT, and if you compare the last OCT, the 24 weeks post 3rd dose of Vabysmo with the first OCT, you can see the durability and the excellent effect it has on the intraretinal and the subretinal fluid. This was, a particularly, interesting case. She's a, 45-year-old software engineer from Gurgaon, and she was very frustrated because there was multiple recurrences after multiple injections of anti-VEGFs, ranibizumab and brolucizumab elsewhere. Came to us again in February last year and had, this CNVM with RP duplication, and you can see the last OCT in which there is a complete resolution of fluid, and she's maintaining that even after 2 doses of Vabysmo. Coming to PCV cases, a lot of bleed and exudation you see in the left side of the fundus photograph. And actually, we were planning to, go for a intravitreal TPA and anti-VEGF, but again at that time, Vabysmo was launched in India, and we thought that we would try this new drug. And this is the 4 weeks post Vabysmo fundus photograph. You can see the complete resolution of the heme here, and of course the corresponding OCTs and the complete resolution of intraretinal and subretinal fluid, along with the drastic decrease in the bleed. 60-year-old gentleman, multiple PEDs with intraretinal subretinal fluid, again a switch patient, multiple anti-VEGFs were given, one-eyed, and this gentleman was given 3 doses, and you can see the serial OCTs on the right side. There is a considerably flattening of the PED, a complete resolution of the intraretinal and subretinal fluid. The vision is maintaining at 6-9 parts because of the good fovea, and presented with 660 vision, has not required a 4th injection till now, and has been now 20 weeks post 3rd injection of Vabysmo and is in constant follow-up. Again, a young patient, 30-year-old tech engineer from Jaipur, multiple anti-VEGFs given elsewhere, always a subfoveal recurrence, young patient, And this is one of the most dramatic effects of this drug, and it's been now 1 year, and the patient has not required after the loading doses a fourth injection. And if you see the last OCT, and you cannot imagine that this was the first OCT pre-injection, and the patient is actually very happy with 6/6 vision, no metamorphosia and no recurrences. More severe cases, you can see the height of the PD, the amount of bleed here, and multiple PEDs and intraretinal fluid, and presented with the fresh bleed, drop in vision. 3 loading doses were given. So the right side OCTs, the middle OCT is after the 3 doses, 16 weeks post the loading dose, and had a recurrence at 20 weeks, and then we re-injected this patient after 20 weeks of the loading dose, and is stable now. And now we have switched the patient to treat and extend here. Again, you can see the multiple PEDs and the subretinal bleed and hyperreflective area, and multiple anti-VEGFs. Again, a switch patient. 3 loading doses were given. You can see the serial OCTs, and if you see the last OCT and compare it with the first OCT, the PD height has totally flattened. The macula is dry, and the vision is maintaining at 6/12 parts. Again, the patient has not required a fourth injection in these cases. I'm talking of the initial experience of the most severe cases. Of course, not every patient does that well. You can see the octa also, and no vascular reactivation in these patients. So this patient was a vitrectomized patient, had vitrectomy with subretinal TPA for a massive submacular bleed post PCV last year, and again presented after 1 year with a bleed. At that time, you can see the thumb-shaped PED, and we injected the patient with Vabysmo, and you can see the resolution on the left side. The bleed has gone, and if you see the last OCT and compare it with the first OCT, that PED is totally flattened, the fovea is dry, the patient is maintaining 6/9 vision after the loading doses. Again, subretinal hyperreflective material, a lot of bleed here. This was a particularly resistant case. We normally give 3 doses of Vabysmo in our practice. This patient required 4, and the final visual acuity is 6/18. Again, you see the serial OCTs, and the last OCT has no PED, no fluid, and no heme, as observed in the fundus photographs also, and there is no recurrence after the loading doses. The patient is on 20 weeks post-Vabysmo follow-up. So our experience right now is about 318 injections. But many patients are in their first dose, many are in second, some are third. Initially, we tried some PRN dosing also. So, and you can see in PCV patients, almost after 1 month, every patient had a considerably decreased PED height. So almost 50% PED height and central subfield thickness decrease was there in all these patients. But just to collate all the data and to cut the long story short, if you see, this is the data of 50 patients of nAMD in my practice, which have received 3 loading doses and have a follow-up of more than 4 months now. So 85% are on Q12 dosing, and more than 66% are on Q16 dosing. So to summarize, in Vabysmo, there is greater numerical gain in vision even after the first injection, and all parameters like intraretinal fluid, subretinal fluid, the bleed, as you have seen, the PD height gets improved. And it has a robust safety profile. In my practice, I have not incurred any serious intraocular inflammation cases till now. Still an evolving data, as I said in the beginning. The data sample size is modest, the follow-ups are short, but maybe early next year or later next year, when all these patients will be in their Q12 and Q16 dosing regimen, we'll be able to say confidently about the efficacy. But if my patients of nAMD require 3 or 4 injections in a year after the loading doses, I think this drug will be a game changer. Thank you.